Hello everyone. So this is the session of Meninges of the Brain. So actually this is again the session continuation of Conquer NEET PG 2022 session. Today's topic is Meninges of Brain, which is a highly beneficial topic, and it's very important concerning the MCQs which has been asked in the previous year from this topic. So we want to concentrate on this topic, and I would like to clear your concept about the topic of Meninges of Brain. So before that, meanwhile the students is also joining, I would like to tell you about myself. Myself, Dr. Monalisa, I have done my MD Anatomy from Armed Force Medical College, Pune, and I have got a total of 8 to 9 years of teaching experience for the past years for the various competitive exams in the medical field. So let me tell you about the special class features. When I am talking about the special class, it's an interactive live session where the learners and the educators interact. Polls are conducted where the learners can interact and they can ask your doubts live in the session. Never raise a so what happens? Never miss a class. What does that mean? That once you start seeing the session on the free platform of Unacademy, you can also follow that educator on the Unacademy app, and thereafter you will get notification of each and every session taken by the educator. That means you are not going to miss any of the session of that educator. Raise your hand and get your doubts cleared. Lecture notes. So once the session has been taken, after that PDF notes is downloaded, and PDF notes can be downloaded, and you are not going to miss out any of the session, and you will get the PDF notes of each and every session. That is the key point, and that is a very useful point which is present on the special free class of Unacademy. Anywhere, anytime, read from the top educators of Unacademy platform. I would also like to inform you, I want to give you the information regarding my grand MCQ series. This is present on the special free platform of Unacademy. So my dear aspirants, we have already covered up the 6 sessions today. Today is the 7th session, and tomorrow is the 8th, and day after tomorrow is the 9th session. So these are the session details. 9 PM is the timing of the session detail every day. So do join me live for this session on the Unacademy app. These sessions are on the Unacademy app. Use the code ANAT10 to unlock and also to get the 10% discount if you are wanting the subscription of Unacademy or Iconic subscription. Let me tell you about the plus subscription. When I am talking about the plus subscription, you can access both live and recorded version of the classes. You can learn from the top educators of top educators in the medical stream, and you can also compete in the live test and quizzes. Study on the device of your choice. Assess more than 25,000 MCQs, and soon you are provided with if you are taking the subscription of 1 year or more, you are soon provided with the printed notes. Okay, so these are the benefits which can be catered by you. The MCQs which is on the plus platform, that is of 25,000 MCQs, that is based on latest pattern of examination. So you can solve it, and you will get a detailed explanation for each and every MCQs by the top educators of Unacademy platform. You can access all the 19 subject live and recorded version. Now let me talk about the Iconic subscription. When I am talking about the Iconic subscription, it means you are getting the benefits of both Unacademy Plus course and that of Prep Ladder. So both that benefits can be catered by you, and also what is gained is that you can have the benefits of Plus course of Unacademy and also the benefits of Prep Ladder. That means you can access best of the two platforms for your competitive exam, NEET PG, INICT and next. Clinical integrated essentials, benefits of Prep Ladder, video lectures from the dream team of Prep Ladder, QBank 3 can be accessed, rapid revision, snapshots and treasure dream notes of 2021. All these benefits can be gained by you. I would also like to, before starting the session, I would also like to tell you about the comparison. So this slide is showing you the comparison detail of Plus and Iconic, which you can see where the comparison has been done. NEET PG subscription pricing detail, and you can get a discount of 10%, additional discount. Already this is at a discounted rate of 10%, additional plus 10% discount, that is a total of 20% discount and more by using my code ANAT10. So just go for this and grab this opportunity and take the subscription of Plus or Iconic, which is highly beneficial for you. So my dear aspirants, let's start the session now. Okay, so today's topic is Meninges of the Brain and the learning. So before starting the topic, I would like to tell the learning objective of this session. What all things I want to complete in this topic. So I would like to talk about the learning objective of this session. So let's talk about that. So I would like to talk about the attachment of all the dural folds and its content. This is the first thing which I am going to complete in this session. Then we should go with the discussion of arterial supply and the nerve supply of the dura mater This is very important. Now, the other important point is to know the enumeration of paired and the unpaired dural venous sinuses, and other than that, it is important to know about subarachnoid cistern and its content. So, few important subarachnoid cistern is there, and that is important along with its content, which I will revise. And the last topic is cavernous sinus, one of the dural venous sinus which I want to brief slightly more detail. Why? Because this is another important topic for your NEET PG 2022 examination. So, these are the learning objective, and let's achieve it. So, let's start with the session now. The first thing which I want you to know is about the dural folds. So, this is a cadaveric image where you can appreciate the dural folds. So, you can appreciate the dural folds. Okay. Okay. So, now when we are talking about this, we are talking about this. So, we should also know about the dural folds. We should clearly know about the, we should know about the dural folds. So, in this image, I would like to tell you about the dural folds. I would like to tell you about the dural folds. Okay. So, let me enlarge this diagram first. Okay, let me enlarge this cadaveric image so that you can understand the dural folds now. Got it? So, we can understand the dural folds now. So, let's see. So, this is the dural folds. So, here what you can see, the important dural folds are dura mater, arachnoid, and that of pia mater. So, from outside to inside, the brain and the spinal cord is having the folds and the coverings, that is a protective covering, that is called as meningeal covering, and it is consist of dura, arachnoid, and the pia. So, here we can see the layers covering. So, here very nicely you can see, let me highlight that folds. So, this fold which I am highlighting you is the dural mater. So, when you are seeing the dural fold, it is tough, inelastic, it is tough, inelastic, and it is tough, inelastic, which is giving a protection to the brain structures, and this is the outermost covering. And next to it, the another layer which can be highlighted, I am using pink color for this. So, next layer, so that you can understand, which is loosely attached over the brain, that is subarachnoid space, and the most innermost structure is the pia mater, which is quite adherent. So, you can see cerebral cortex covered with the pia mater. So, this is quite adherent to the brain surface. This is quite adherent to the brain surface. Other than that, the other layers which is seen here, so let me show you the other layers which is visualized here. So, the layers of scalp, so you can see here, this is the scalp which has been shown, and we know that in the scalp we have got 5 layers. The outermost will be the skin and the dense connective tissue which is enclosed in the scalp, and other than that you can appreciate this is the epicranial aponeurosis, aponeurotic layer is there. Next will be the loose connective tissue layer, which is the 4th layer and the danger layer of the scalp. This is the 4th layer, loose connective tissue layer, and next will be the pericranium or the cranium of the skull. And when the cranium is opened up, the 3 layers of the meninges, that is the which is seen, this is the cranium of the skull. So, thereafter you can see the dura mater, the arachnoid mater, and the innermost is the pia mater. So, these are the layers which is visualized here, and very nicely we can appreciate all these layers in this diagram. So, okay, let me give you certain important points about the meninges of the brain. So, yes, let's talk about that. Write on the heading, meninges of the brain. So, actually meninges of the brain, what I am talking about, actually meningeal covering is present on both brain and the spinal cord, and it's a protective covering which is covering the brain surface, and it's a membrane which is from outside to inside. If I talk from the layers outside to inside, it is made of following layers. It is made of dura mater, it is made of arachnoid matter, and it is made of pia matter. Okay, it is made of dura, arachnoid and pia matter. Okay. Now coming to the dura matter. Dura matter, when I am talking about the dura matter, it is the thickest layer or the outermost layer. It is thick outermost covering of the brain and the spinal cord. So it is the thick and the outermost covering of the this is the thick outermost covering of the brain and the spinal cord, which is called as, so in the brain it is called as the cerebral dura matter, and in the spinal cord it is called as spinal dura matter. So why I'm stressing upon this point? Why? The reason is that there is difference between the cerebral dura matter and that of spinal dura matter. So let me tell you about the difference. The difference is that when I am talking about the brain dura matter, that is cerebral dura matter, it is consist of two layers, that is meningeal and endosteal layer. When we are talking about the spinal dura matter, it is just made of one layer. It is just made of one layer, that is called as meningeal covering only. When in case of the cerebral dura matter, the dural matter folds and conform dural folds, it conforms septae and it can enclose dural venous sinuses. This is not the case in the spinal dura matter. So this is the difference which is lying. And the dura matter, if I talk about the dura matter or the cranial dura matter, it is tough. It's a tough like layer. It is inelastic membrane. It is tough and it is inelastic membrane made of fibrous tissue, which is made of fibrous tissue, Now the next layer is arachnoid matter. Let's talk about, so this was the outermost or the first layer which we talked, and let's talk about the next layer. The next is arachnoid matter. The second layer is arachnoid matter. When we are talking about the arachnoid matter layer, it is actually cobweb like, it is web like. Matter means mother, the word matter means mother, and it is delicate and avascular layer. It is delicate, it is avascular layer lying below the dura matter, and it will have many thread like trabecules extending from it to that and going towards. So it is in the form of many thread like trabecules are extending from the arachnoid matter to the pia matter. The next layer is the pia matter. And when we are talking about the word pia means tender. So it is very tender and it is very much adherent. It is quite adherent to the brain surface. Cerebral hemisphere, it is quite adherent to the brain surface and it is closely adherent. It's quite closely adherent to the brain and also the spinal cord. Okay, now I would like to show you a diagram. One more thing is important is that both arachnoid matter and that of pia matter, when taken together, these two layers when taken together, it is called as leptomeninges. These two layers together is called as leptomeninges. Arachnoid and pia matter together is called as leptomeninges. Any doubt, please let me know. My dear aspirants, if you have got any doubt, please let me know. Together, the arachnoid matter and pia matter is called as leptomeninges. Now, let's talk about the layers from outside to inside. The layers are, so let me show you a diagram. This is a schematic diagram to make you understand the layers. So, from outside, the first layer which you are seeing here is the scalp. Underlying scalp, there is the skull layer, and then you will have the two layers of the dura matter. So, what I have told you, in case of the cerebral hemisphere, the single dura matter is the layer in the spinal cord. But when I am talking about the cerebral hemisphere, when we consider brain, in the brain we have got two layers. The outer is the perosteal layer of the dura matter and the inside is the meningeal layer. Next layer will be the arachnoid matter. Then we will have a space, that space is called a subarachnoid space, okay, and then we have got a pia matter. Then we reach the cerebral cortex. So this is the segregation and this is the layer from above to down. Now let's talk about further details of dura matter. So let me write the heading, the dura matter. Now dura matter in the cranium, it is called as, so I would like to more stress upon the cranial dura here. The cranial dura is consist of two layers. My dear aspirants, what is the name of that layer? The two layers, what is the name of that layer? outer endosteal layer and inner meningeal layer. Outer endosteal and inner meningeal layer. Now, these two layers, when we are talking about, these layers, so this is, I am talking about dura mater, these two layers are adherent to each other. These two layers are adherent to each other except where they enclose or splits to enclose dural venous sinus. So, the two layers of the dura mater will be found adherent to each other, but at certain reason it is enclosing a space, and that space is containing dural venous sinuses or dural septa. So, two layers are adherent except, so dura mater as a whole, the two layers will be adherent to each other except where, my dear aspirants, at the level of dural venous sinuses and dural septas or dural septas. Okay. So that means the splitting of the two layers of the dura mater. So that means splitting of the two layers of the dura mater, that is the meningeal and the endosteal layer splitting, will give rise to formation of dural venous sinuses. Okay, so got it, my dear aspirants? Okay. So yes, let's talk about the next. Now let me give you further detail of endosteal layer, more details of endosteal layer. When I am talking about endosteal layer, it is attached, the endosteal layer is attached to inner surface of, endosteal layer is attached to inner surface of cranial bones and is continued through the sutural ligament. So, endosteal layer which is attached to the inner surface of cranial bone, it is continuous through the sutural ligaments around the margins of foraminas. So, in the cranium there is so many foraminas, so this endosteal layer will be continuous along the margins of these foraminas. Okay. When I am talking about meningeal layer, that means meningeal layer part of the dura mater, it's a strong fibrous membrane, and this cranial dura mater will become continuous with the spinal dura mater. What is the level where the cranial dura mater becomes continuous with the spinal dura mater? When the cranial dura mater becomes continuous with the spinal dura mater, that level is at the bony level, that is foramen magnum, foramen. So, write down. Meningeal layer is a strong fibrous membrane. It's a strong fibrous membrane, and it becomes continuous with, the spinal dura at the foramen magnum, at the level of foramen magnum. It insets the cranial nerves in the osseous foraminas and fuses externally with the epineurium of the important cranial nerves like optic nerves. Okay. So, this is about the two layers, and now let us talk about the dural folds. Okay. So, I would like to give you the details about the dural folds and two dural folds. So, in respect to the cranium, we have got four important dural folds which needs to be explained one by one. What are these four folds which we have to study in detail? The four folds, the four dural folds are Flax cerebri, Tentorium cerebelli, Flax cerebelli, Diaphragma cella. So, these four dural folds should be studied in detail. So let's talk about individually these folds detail. So let's talk about the first. So yes, the important dural folds which has been shown in this diagram and which needs to be studied. So the folds. So here you can see this is the sickle shaped fold which I am highlighting here. This fold, I am talking about this fold. This fold is, this is the fold which I am talking about. Flax cerebri. Lower down you can see this small fold. This is the flax cerebelli. This fold is Tentorium cerebelli. And one more is the Diaphragma sella. So it is important that we should know the details of all these folds. So first thing which I want you to explain. So again have a look on this cadaveric image. So okay, have a look on this cadaveric image where you can clearly see the dural fold and this is the flax cerebri. So you can appreciate the flax cerebri. The flax cerebri is a sickle shaped dural fold. Francis, yes, hello Francis. So what I am showing you in this cadaveric image, can I highlight this image so that the image is more clear? So I am highlighting this flax cerebelli which is seen as a sickle fold. This is a sickle fold, dural fold, which is exactly, if you will see, it is exactly lying between the two cerebral hemisphere. Satyam, hello dear. So hello everyone. So see here, the flax cerebri is a large sickle shaped fold of dura mater which dips in the longitudinal fissure between the two side cerebral hemisphere. So here you can nicely appreciate, my dear aspirants, here you can nicely appreciate that this is the in between the two side cerebral hemisphere. So see here, the two cerebral hemisphere has been shown here. So see here, this is the cerebral hemisphere of one side, this is the cerebral hemisphere of other side. So in between these two cerebral hemisphere, here somewhere the dipping. So this is longitudinal fissure and in between the two cerebral hemisphere in the longitudinal fissure there is dipping of the flax cerebri. What dips inside? The flax cerebri, which is lying between the two side cerebral hemisphere. So this is one side cerebral hemisphere and this is the other side cerebral hemisphere. So in between the two side, you can say right and the left side cerebral hemisphere. The end, so you can appreciate this is the anterior end, this is the narrow anterior end and this is the posterior end. Okay, A for anterior and this P for the posterior end. So the narrow anterior end of flax cerebri, it is attached to a bony prominence which is lying inside the cranial cavity anteriorly, which is called as crista. What is it called as, my dear? Crista galli. And posteriorly you can see the posterior end of the flax cerebri will rest over tentorium cerebelli. So write down, this is very important for you to know. So let's write the details of flax cerebri. Important points, write down. Flax cerebri is a large sickle cell. It's a large sickle cell shaped vertical fold of dura mater which dips into the longitudinal fissure, between two cerebral hemisphere, cerebral hemisphere. Its narrow end next time to start preparing for the next PG. Now itself, dear, start the preparation now itself. Bansal, this is the right time to start the preparation. Its narrow end is attached to crista galli and its broad posterior end is attached to the upper surface of tentorium cerebelli, upper surface of tentorium cerebelli. Got it? Never late. Okay, Bansal, it's never late. You can start the preparation right itself. So this is the attachment. So actually, if you will see the Flax cerebri superior surface, if you will see the superior view of Flax cerebri, its convex upper border is attached. So if you will see the upper border, so write down the convex upper border. When I am talking about the convex upper border of Flax cerebri, where it is attached, my dear aspirants, all these points which I am writing, it's very, very important for you. So its convex upper border of Flax cerebri is attached to sagittal suture margins, and its concave inferior border, concave free border which is lying downwards. It is free, it is not attached, it is, so two borders are there. One is the upper convex border which is attached to sagittal suture, and the lower is the concave free border. Now the other point which is also important for you is that what does it enclose? What does this enclose? So actually I want you to show the posterior view of the Flax cerebri. See here, let me highlight this diagram which is again a cadaveric image. So here you can see this is the Flax cerebri posterior end, and you can see here this Flax cerebri posterior end is resting over this dural fold. And what is this dural fold? This is tentorium cerebelli. So very nicely you can appreciate the posterior end of Flax cerebri is resting over the tentorium cerebelli. And here it is enclosing a sinus, my dear aspirants. So see here, this is the sinus. What is this sinus? Straight sinus. So superiorly it will enclose, can you see, superiorly it is enclosing the superior sagittal sinus, and inferiorly it is enclosing the straight sinus. Flax cerebri, superiorly it is enclosing superior sagittal sinus, inferiorly the lower margin merging over the tentorium cerebelli is enclosing the straight sinus. So yes, let's write this. So dural venous sinus. So same thing here, I want you to show the another image where you can highlight and see the dural venous sinus. So in the cadaveric image, it has been already shown you the dural venous sinus is enclosed by the Flax cerebri. This is another diagram, sagittal view, where you can see the important sinuses enclosed. So here you can see here, this is the important sinus which is enclosed superiorly. What is this sinus, dear? This is SSS, superior sagittal sinus. Here there will be a lower end, it is enclosing straight sinus. So write down this point, straight sinus. So write down Flax cerebri encloses mainly 3 dural venous sinuses . Okay, one more sinuses which I want you to show here. So yes, lower down you can see here lies the inferior sagittal sinus. So lower margin will be having inferior sagittal sinus, and at the junction of the tentorium cerebelli there will be straight sinus. So at the junction of tentorium cerebelli, straight sinus, lower margin is the inferior sagittal sinus. So write down Flax cerebri encloses 3 dural venous sinuses. Please write down the name. Superior sagittal sinus, is enclosed in the upper attached border, Inferior sagittal sinus is enclosed in the lower free border, and the straight sinus, 3 sinuses. One is the straight sinus. Straight sinus is enclosed along the line of attachment, along the line of attachment of Tentorium cerebelli, along Tentorium cerebelli. Done. Now let's talk about the another one, that is Tentorium cerebelli. So next dural fold which I want to explain is the Tentorium cerebelli. Now Tentorium cerebelli, it's very important to understand the details of Tentorium cerebelli. Has been asked as an MCQ session, also as a cadaveric image based session it has been asked. So let's talk about that, Tentorium cerebelli. It's a tent like semilunar fold of dura matter, and exactly it is forming a sloping surface. It is resting over it is forming a roof for posterior cranial fossa. Exact location is, it is lying between cerebellum below and the occipital lobe of cerebral hemisphere above. So again let me highlight this diagram. So here I would like to use a green color, and this tent like fold which you are seeing, can you see here this tent like fold which is shown to you? This tent like fold is the Tentorium cerebelli. This Tentorium cerebelli is forming the roof of posterior cranial fossa. It is forming the roof of posterior cranial fossa. It is forming the roof of posterior cranial fossa. Okay. And here also one more thing you can see here nicely, it is enclosing 2 sinuses. This is superior petrosal sinus and this is the transverse sinus. So these 2 sinuses are enclosed by it. See here, if I enlarge more, see here. See here, this is Tentorium cerebelli. This will be the Tentorium cerebelli, which is forming the roof of posterior cranial fossa, separating the superiorly क्या रहेगा? Superiorly cerebral hemisphere, inferiorly will be the cerebellum. Which 2 sinuses is it enclosing? The 2 sinuses enclosed by it is superior petrosal sinus and that of transverse sinus. Got it? Now let me give you the concept that it is exactly lying between the occipital lobe of cerebral hemisphere above and the cerebellum below. That means it is protecting the small brain, that is cerebellum, from not getting crushed by a heavy weighted occipital lobe of cerebral hemisphere. Other important thing which you can appreciate, let me again highlight this diagram, that this is the border which is the free margin. Can you see here? This is the free margin. This is the free margin of the Tentorium cerebelli. This is in the form of U shape. Actually what happens, this is in the form of a oval notch which is called as tentorial notch. What passes through tentorial notch? So through this space midbrain passes and it forms a connection. It forms a connectivity between the hindbrain and the forebrain. Got it? So this is the free margin, and when we are talking, so these are all attached border. This is all the attached border. This is all of the attached border. Yeah. Yeah, okay. Yes, Ujjwal Tiwari. Yeah, sure, Ujjwal. Everything is covered in much detail, and yes, all the things which is covered up in the topic of Unacademy is in a sequential manner. So definitely you can take it, Ujjwal. So and you will actually, I have seen many of the students has been taken and they have got a maximum benefit. So they are understanding the concept very nicely, and now everything is getting integrated. So you can definitely go for it, Ujjwal Tiwari. So this is the attached border, and what you can see that this attached border is attached, so anterolaterally and posterolaterally. So anterolaterally, if I talk AL, I will use, this is the anterolateral border and this will be the posterolateral border. Posterolateral border. Okay. So anterolaterally it is attached to the superior border of petrous temporal bone, and posterolaterally it is attached to the lips of transverse sinus. So all these details has been clear from this topic. So Let me write it and then I will show you one more. Okay, this is the diagram. One more cadaveric image I want to show you once more. So yes. So let's focus on this diagram very well, because you will have a concept of tentorium cerebelli importance function. So let me again highlight this. So my dear aspirants, what I told you, the tentorium cerebelli. So you can see here, this is tentorium cerebelli, this seat, okay, and this dural fold you can see is exactly between the, what is this lobe my dear aspirant? This is cerebral hemisphere of both the side, and what is it? This is occipital lobe of cerebral hemisphere of right and the left side. Can you see occipital lobe of right and left cerebral hemisphere? So these are occipital lobe of right and left cerebral hemisphere, and below is the cerebellum. Below is the cerebellum. Got it? Below is lying the cerebellum. So tentorium cerebelli is protecting the cerebellum, not being crushed by the occipital lobe of cerebral hemisphere. Got it? So let me write this information and then we will proceed on to the other one. So write on the heading and write certain important points about tentorium cerebelli. It's a tent-like semilunar fold of dura matter. It's a tent-like semilunar fold of dura matter which forms the sloping roof of, which is forming the sloping roof of posterior cranial fossa, lying between cerebellum below and occipital lobe above, occipital lobe of cerebral hemisphere above. Got it? Now, inner concave margin, inner concave free border, inner concave free border, inner concave free border is called as oval notch, and this oval notch is called as tentorial notch. Tentorial notch, actually it acts as this tentorial notch. My dear aspirants, this tentorial notch will act as a door of tentorium. What do you mean by the word door of tentorium? Means this notch will form connectivity between the hindbrain and that of forebrain. So midbrain is forming, midbrain is passing through this tentorial notch, and this will connect hindbrain to that of forebrain. Got it? Now, what about the outer attached border? So write down outer attached border. When I am talking about outer attached border, my dear aspirants, it's anterolateral. I am writing in short form. Anterolateral part is attached to superior border of petrous temporal bone. Superior border of petrous temporal bone. Posterior half, that is posterolateral attached border, posterolateral attached border is attached to lip of transverse sinus, lip of transverse sinus. It is attached to the lip of transverse sinus and also to the posterior clinoid bony processes, posterior clinoid processes. So done. Next important point is that you should also know that which sinuses are enclosed by it. So we have already seen in the diagram, those students who are remembering it, they can write sinuses include. Can anybody tell me the sinuses include? Sinuses enclosed by tentorium cerebelli. We have already talked about this. Which sinuses are enclosed, my dear aspirants? Superior petrosal sinus, superior petrosal sinus along the attached anterolateral border, and posterolaterally it is enclosing transverse sinus. Got it? Now let's talk about the third dural fold, that is Flax cerebelli. Let's talk about Flax cerebelli. When I am talking about Flax cerebelli, it is a small sickle shaped fold of dura matter, which is exactly intervening. So this small fold of dura matter which you are seeing, okay, let me use a green color for it. This fold, I am talking about this small fold, okay, this small fold. This is Flax cerebri, and this small fold of the Flax cerebelli is enclosed between the two cerebral hemispheres, cerebellar hemisphere, cerebellum. It is attached to internal occipital crest and it is enclosing one small sinus, that is occipital sinus. Write down. Write down the detail. All the students who are present for this session should also can join me 9 p.m. Unacademy app free session. Use the code NAT10 and do present in this session for the special class series, that is 9 p.m. session, okay, MCQ session. So that would be highly beneficial. So you can just come on the Unacademy app and you can also get the PDF notes. Now let's talk about Flax cerebelli. Small sickle shaped fold of dura matter, small sickle shaped fold of dura matter intervening between the two cerebellar hemispheres. Attached to, where it is attached? So it is attached to internal occipital crest. It is attached to internal occipital crest. And what it is enclosing? It encloses one small sinus, that is called as occipital venous sinus. It is enclosing occipital venous sinus. Occipital venous sinus. So yes, we have done with this Flax cerebelli. Now let's talk about the next one, that is so now we have talked about all the three, and which is the last fold which we have to discuss, that is the diaphragma sella. So let's talk about diaphragma sella. So my dear aspirants, okay, I can understand many of the students always ask for the PDF notes. So actually when you attend the session on live, on Unacademy app, you will get the PDF notes. YouTube session, though it's not possible, but if you come on the live sessions of Unacademy app, you will definitely get the PDF notes, and always I take many sessions free on the platform of Unacademy. So you can join me live for that. Diaphragma sella. You can also revise number of times whenever you want. You can you will have this images and you can click take the snapshots, my dear aspirants. So diaphragma sella, which is called as Tentorium hypophysi. It's a small circular fold of dura matter which is forming roof of pituitary fossa, that is sella turcica. It is also having an aperture. Can anybody tell me what is this aperture is? Why the aperture is there in diaphragma sella? Why this aperture is there in the diaphragma sella? Through this aperture, which structure passes? It gives passage to stalkopituitary gland. Done? Now, So I would like to show you this diagram where you can see, let me just highlight this, that is showing you the diaphragma sella. So yes, this is the diaphragma sella which you can see here. This structure is the diaphragma sella. Here there is also a gap, as you can see, in the diaphragma sella, and this gap is for which structure? This gap is for pituitary stalk. So done. Now let's talk about, so we have done with the, so one cadaveric image. So can you see, this is a cadaveric image where you can see very nicely the diaphragma sella. So this is the diaphragma sella which you are seeing. This can you see here, which I am highlighting with the green color. This whole is the diaphragma sella. This enlarged view is showing you the cadaveric image of the diaphragma sella, which is lying over the cranial cavity, and very nicely you can aperture is there in the middle, and the structures traversing through this aperture, this is the stalk of the aperture. This is structure which is traversing through the stalk, this aperture, this is the pituitary stalk. This structure is the pituitary stalk. Got it? Infundibulum. Satyam Bhardwaj. Absolutely right, Satyam. Absolutely right, Satyam. Yes. Now let's talk about, so let me give you the detail about the nerve supply and arterial supply of the dura mater. Nerve supply and arterial supply of dura mater. Nerve supply and arterial supply of dura mater. Right on. Arterial supply of dura mater. The arterial supply. So the arterial supply of dura mater. So you can write dura mater is supplied by numerous branches of internal carotid arteries. I will try to cover up the entire topic, but if some important parts remains, I will take another session, maybe tomorrow or day after tomorrow. So I will give you the link and we will have that session, remaining part also, don't worry. Arterial supply of dura mater is, the arterial supply is having numerous branches of internal carotid arteries. It is getting blood supply from ascending pharyngeal arteries also. Numerous branches of internal carotid artery, ascending pharyngeal artery, also branches of maxillary artery, occipital artery, and that of vertebral artery, branches of vertebral artery. Got it? Okay. Okay, I will come to you, Satyajit. So yes, Satyam Bhardwaj, are you a student of, so yes, Satyam. So I will come to you in the end, I will tell you all these points, don't worry. So yes, Satyam, are you a student of first year MBBS or you are preparing for the next PG? Let me know. So all the details are there in the channels, in the Telegram group also. Let's talk about the nerve supply. Three divisions of trigeminal nerve. First, three divisions of trigeminal nerve. First three cervical spinal nerves, cervical sympathetic trunk, so if I talk about Satyam ma'am, yes ma'am, third year students start preparing for. So great Satyam, you have start preparing for the next third year. So today 9 p.m. So today 9 p.m. also tomorrow 9 p.m. Satyam, today 9 p.m. and tomorrow 9 p.m. Okay, 3 divisions of trigeminal nerve. First 3 cervical spinal nerve, cervical sympathetic trunk. So actually, if I talk about the supratentorial dura, it is getting innervation from the meningeal branches of the divisions of trigeminal anterior, that is the meningeal branches of anterior posterior ethmoidal nerves, and also the meningeal branches of maxillary and mandibular nerves. Okay, so first 3 cervical spinal nerves, also the trigeminal nerves, also the cervical sympathetic trunk. And infratentorial dura is supplied by ascending meningeal branch from upper 3 cervical nerves. Upper 3 cervical nerves. Now let's talk about dural venous sinuses. So let's talk in brief about dural venous sinuses. Dural venous sinuses. Dural venous sinuses is formed by following 2 ways. It is formed by following 2 ways. One is by the separating of 2 layers of dura mater. One is by separation of 2 layers of dura mater, that is cranial dura mater. Other is reduplication of meningeal layer of dura. Other is reduplication of meningeal layer of the dura. Okay, so this is the 2 ways by which the dural venous sinuses is formed. This is the 2 way which leads to the formation of dural venous sinus. One is by separation of 2 layers of the dura, other is by reduplication of meningeal layer of the dura matter. Dural venous sinuses has got certain characteristic feature which must be known to you. Okay, so the features of dural venous sinuses. So I want to add on many important points. I want to give you the details of cavernous sinus and also the details of subarachnoid cistern. So I will also take a part 2 of this series, because I think today I will be not able to finish, because from 9 p.m. I have to start the session of special class also. So I will just split this session into 2. So this will be the part 1. I will take another session which is meninges part 2, in which I will cover up subarachnoid cistern and cavernous sinus. So dural venous sinuses. What are the features? Dural venous sinuses are lined by endothelium, and these lining of endothelium becomes continuous with the lining of veins, dural venous veins. If I talk about the characteristic feature, अगर characteristic feature की बात करें, if I talk about the characteristic features of dural venous sinuses, the important characteristic features of the dural venous sinuses is that it is having no valves. It is having no valves. So that means if it is having no valves, that means blood can flow in either direction. It is having no valves, that means blood can flow in either direction. Devoid of smooth muscles fibers in their wall. They are devoid of smooth muscle fibers in their walls, and have cerebral diploic and meningeal veins as their tributaries. So, have cerebral, diploic and meningeal veins as their tributaries. The other important point is that, as we know, the communication is occurring via valvulus emissary vein. So, dural venous sinus also form communication via emissary veins with the extracranial. So, this emissary vein is forming, it's forming a route of communication. Okay, dural venous sinuses is forming a communication. So, actually emissary vein is forming a communication between dural venous sinuses and that of extracranial veins. That means infections from extracranial veins can drain via emissary vein into dural venous sinuses. Now, one more thing I want to tell about extradural hematoma. What is extradural hematoma? So, actually this is a clinical correlation. So, extradural hematoma means in any kind of injury, actually this is generally there is no epidural space or extradural space present in the brain surface. But if there is any kind of injury on the dural surfaces, at times there can be a bleeding from. So, there can be a bleeding from the frontal trunk of middle meningeal artery, and there can be collection of blood which is called as epidural hematoma. The deep collection of blood below the dura is called subdural hematoma, and generally these are venous collection of the blood, but the blood collected from a frontal trunk of middle meningeal artery is called as epidural hematoma. So, extradural hematoma and subdural hematoma differences are generally on appearance. Extradural hematoma is biconvex or lenticular in form. It is generally on the temporo or temporoparietal region, and as I told you, it's the middle meningeal artery which is involved. Middle meningeal artery is involved, entire surface of the brain is involved, and bridging vein is involved. Lucid interval is correctly there. The person will regain consciousness for some time and again become unconscious. Lucid interval is absent in case of subdural hematoma. Outcome and poor prognosis, much more poor prognosis in there is the case of subdural hematoma as compared to extradural hematoma. Okay. Now, I would like to show you the certain important dural venous sinuses. It is important for you to know the details of dural venous sinuses. So, we have got a list of paired and unpaired dural venous sinuses. Okay, like superior sagittal sinus, inferior sagittal sinus, straight sinus, intercavernous sinuses. These are all example of paired unpaired sinuses. We have got cavernous sinus, we have got sphenoparietal cavernous sinus, we have got sigmoid transverse sinus. These are all paired, and occipital sinus are again unpaired. Okay. So, let me give you the list of paired and unpaired dural venous sinuses. So, write down paired dural venous sinuses. Paired dural venous sinuses. The paired dural venous sinuses are following: cavernous sinus, superior petrosal sinus, inferior petrosal sinus, superior petrosal sinus, inferior petrosal sinus, cavernous sinus, paired word, sphenoparietal sinus, sigmoid sinus, transverse sinus. Transverse sinus, right and the left transverse sinus. So, these are all example of paired dural venous sinus. Now, talking about unpaired dural venous sinus. Unpaired dural venous sinuses. Unpaired dural venous sinuses list are superior sagittal sinus, inferior sagittal sinus, anterior intercavernous sinus, and we have got posterior intercavernous sinus, inferior sagittal sinus, straight sinus, occipital sinus. Actually, cavernous sinus is a very important topic which has to be read in much detail. So, cavernous sinus, the continuation of meninges second part, in which I will cover up subarachnoid cistern, important structures located in the cistern, and cavernous sinus there. Okay, pia and arachnoid details also. Now, let me cover up the dural venous sinuses. So, yes. So, now again let me show you this diagram. I just want you to enlarge this diagram and show you the important features of some of the important dural venous sinuses. Okay. Important features of the dural venous sinuses. So, few important features, and I want you to explain what is confluences of sinuses. Okay, that is important for you to know. So, yes, see here, this is superior sagittal sinus. This is superior sagittal sinus which you are seeing. This is the superior sagittal sinus which you are seeing. This superior sagittal sinus is located at the attached border of Flax cerebri. So, where it is located? Superior sagittal sinus located in the attached border of Flax cerebri. What is the extent? It is extending antero-posteriorly from foramen cecum to that of internal occipital protuberance. Inferior sagittal sinus, which is lying in the lower, so few important one I want to brief. It is lying in the free end of Flax cerebri, and it receives veins from the medial surface of cerebral hemisphere. Now, this superior sagittal sinus will also turn to the right hand side to change to right transverse sinus. The inferior sagittal sinus at the junction of Flax cerebri and Tentorium cerebelli will form a drainage. Here it will be joined by great cerebral vein of Galen, and ultimately it will, so you can see here, ultimately when it is joined by great cerebral vein of Galen on this side, as you can see here, this is the inferior sagittal sinus, and you can see here it is joined by the another vein, that is the great cerebral vein of Galen, and it will lead to drainage and form of straight sinus. It will lead to form of straight sinus. This junction where the sinuses are joining is lead to the formation of confluences of the sinus. What it leads to the formation? It leads to the formation of confluences of the sinus. So, let me brief you just these points, and I will end the session in another 5 minutes after briefing this point. So, this was a big topic, and I will continue one more part on this session because I was not able to finish all important aspects. So, just briefing you about important sinuses, and rest topics we will also continue one of the more session I require for it. So, let us talk about in short form superior sagittal sinus. Where it is located? It is located in the attached border of Flax cerebri and extends from you can say antero-posteriorly from the level of foramen cecum, and at the level of foramen cecum, which veins are draining into it? Nasal veins are draining into it, and it will go till the level of IO protuberance. What do you mean by IO protuberance, dear? It is the internal occipital protuberance, and thereafter it will continue onto the right side. My dear aspirants, in the right side, the continuation of the superior sagittal sinus will form right transverse sinus. It will form right transverse sinus. Second one is inferior sagittal sinus. Inferior sagittal sinus lies in the posterior part or 2/3 part of lower free margin of Flax cerebri at the junction of Flax cerebri and Tentorium cerebelli. Tentorium cerebelli. What drains into it? Great cerebral vein of Gallen will drain into it and will lead to the continuation of straight sinus. Will lead to the continuation of straight sinus. Now, this straight sinus, so this is the third one, this straight sinus will turn onto the left hand side and will lead to the formation of left transverse sinus. Straight sinus will turn to the left hand side and will form left transverse sinus. Some other sinuses, let's talk about some other sinuses. So, a small sinus attached at the, so see here, occipital sinus, can you see here, this is the occipital sinus and this is a small sinus which is attached. So, if I talk about occipital sinus, this small sinus is attached to the margins of, along the attached margin. So, it is lying on the attached margin of Tentorium cerebelli and Flax cerebelli, which we have discussed. Here, I want you to tell about confluences of sinus. So, when we are talking about confluences of sinus, few important sinuses are meeting at this point or converging at this point. So, confluences of sinus, as you can see in the diagram, is formed by yes, Satyajit, confluences means important sinuses are draining at this point. See here you can see at the level of confluences, the level of confluences of sinus is external occipital protuberance. Here you can see this is the straight sinus. Okay, straight sinus. This is the superior sagittal sinus. You can see here superior sagittal sinus. Also the transverse sinus is joining here. As you can see, occipital sinuses is joining here, straight sinuses. All these sinuses are joining there or converging at that point. So, confluences of sinus lies at the level of EOP, that is external occipital protuberance, is formed by the convergence of following important sinus: superior sagittal sinuses, left transverse sinus, occipital sinus, and the fourth one is straight sinus. So, is it okay, Bhardwaj? Is it okay, Satyam Bhardwaj? Have you got this point? This is called as confluences of the sinus. So, next to it we have got arachnoid matter, which is a thin transparent avascular structure which is lying between the pia and the dura, and the innermost adherent one is the pia matter. So, I will also take a second session where I will describe few more important points and we will continue the meninges part second, in which I have subarachnoid cistern ka detail mein bataungi. I will also tell you about cavernous sinuses. Before ending, I would like to tell you about my session detail, that 9 PM session I have to start, so only I have to end this session right here. So, let us come on to the 9 PM session now of the special platform. So, I would like to give the information, few of the students were asking for it. So, my dear aspirants, see here. So, today I am taking the 7th session. See here, today I am taking the 7th session, 9 PM 7 December, that is Grand Anatomy MCQs, NEET PG, and targeting the next examination. So, next 2023. So, students can present live for this session. They can download the Unacademy app and they can be present live. They can download and use unlock code NAT10. The link of this session is provided in Let's Crack NEET PG platform. Let's Crack NEET PG and Unacademy NEET PG INICT platform. The link of my session is provided, and you can join me live for this session just now after 5 to 6 minutes. And before ending the session, I would also like to tell that those students who want to take the subscription and you want to study all the subjects in a very systematic way along with notes and everything, you can take the subscription, and for taking the subscription you can use my code NAT10 for 10% discount. That will give you a total of 20% discount. So just go for it and grab this opportunity. All the best, keep studying. Thank you so much. So those who are interested can take the subscription. They can use my code NAT10 for getting and availing the discount. So yes, any doubt, let me know, and don't worry my dear aspirants, the topic will completed in the continuation. I will take Meningeal session 2nd, in which I will cover up arachnoid pia, subarachnoid cisterns and what the subarachnoid cistern contains, and that of cavernous sinus, applied tributaries, relations and everything. So we will definitely come to this topic, don't worry about this. All the best, keep studying. Thank you so much. Absolutely okay, Satyam Bhardwaj. All the best dear. So let me end the session. Thank you, because I have to start the session right itself after 4 minutes. I have got just 4 minutes to start the session. So I will start the session on the Unacademy app. Thank you aspirants. Thank you.